Let's go ahead and call to order. It's regular meeting of the Benefit Health Care District Board of Directors. Right now we have Shelley here, Ken is here, I am here. Rich is on his way, and I think that's where we are for now, because Sherry's not feeling well. So let's go ahead and rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all. That moves us to item number 2, additions or modifications to or deletions from the agenda. I understand that we have to again table the IOR contract, which is item number 11.
What did you say we're doing with that?
We're tabling it again, waiting for USDA concurrence on the contract. Any other questions or comments with regards to the agenda items? Then I will accept a motion to approve the agenda. Thank you, Ken. Do I have a second?
I second.
Thank you, Shelley. All in favor, Shelley? Aye. Ken? And I'll vote aye. Thank you. That moves us on to public comments. There were no comments submitted by telephone, email, or written letters addressed to the board for the meeting. I would like to ask whether there's anyone here or online wishing to make a public comment. Hi, Rich. We're just moving to public comment. All right, so hearing none, we will go ahead and move on to item number 5. Approval of the June 27th special board meeting minutes. The board members had a chance to review the meeting minutes. Do you have any questions, comments, edits? Hearing none, I will accept a motion to approve.
A motion to approve.
Thank you. Do I have a second?
Second.
Thank you. All in favor, Ken?
Aye.
Shelley?
Aye.
Rich?
Aye.
And I'll vote aye. Thank you. And that moves us into item number 6, approval of the June 27th regular board meeting minutes. Board members, any questions, comments, edits for those? No, I will accept the motion to approve.
A motion to approve.
Thank you, Shelley. Do I have a second?
Aye. Second.
Thank you, Ken. All in favor, Rich?
Aye.
Shelley?
Aye.
Ken?
Aye.
And I'll vote aye. And that moves us into item number 7, staff reports. Sean?
Yeah, so my staff report is going to be a little bit different. We're tracking some legislation, quite a bit of legislation actually that's going to affect us. And I've tried to spell it out here for the board to be able to read through some of it. Some of the things that I'm most concerned about obviously is the MCO tax, which is potentially being rolled into general fund, not being used for the purpose, which was going to be a higher reimbursement structure. That's one of them. Yeah, Medi-Cal.
Medi-Cal, sorry.
Yeah. That one's troubling, but we're keeping an eye on it. The other one I want to bring to attention, I want to possibly bring Judy in if I could, is AB 2975, which is the hospital security requirements that's being pushed. There's just a lot of discussion around this. I mean, this is related to metal detectors at all the openings, both the ER and OB and things to that effect. The question is that, well, the cost, the expense of the units, number one, but 2 is what do we do? So this is something that we're opposing because it's just not a well vetted bill. What do we do if somebody if we metal detect a gun or a knife? I mean, so there's a lot of things to be worked through. Judy, if you want to add, you can add to it, but.
And the urban centers, a lot of them already have.
Correct.
This stuff,
They
so
do,
it
they
feels
also
like an
have-
attack on rural.
They have
Security.
a full-time security force, many of whom are retired law enforcement and are trained in practically weapons, knowing what is truly considered a lethal weapon. At our CNO meeting earlier this week, the vast majority of us at Great Access do not have a security force or have a partial security force or are using our maintenance equipment as our security force. We don't have trained staff to manage these weapons. And Linda and I had actually been working on a policy for weapons, mostly related to 5156, etc. And we talked with our local law enforcement, the sheriff's department, and CHP, and they said, we absolutely can help you with the 5150 and we can secure that weapon and found. And that's kind of a big step, right? But we absolutely will not get involved with the other weapon. We don't have any right to remove a weapon, et cetera, et cetera. So this really paralyzes small hospitals and it's unnecessary, it's expense, adding FTEs, et cetera. It's solutioning for a non-existent problem.
Yes, yes.
Who's the sponsor?
Who was the sponsor of that? 1975, San Bernardino was the Democrat, the representative out of San Bernardino, I believe. I don't know, I forgot their name. What's that?
In a rural area?
No. It's an area that has like veteran communities. So there's a kind of a mix between an urban and a suburban and a rural. So it's that, there's, I guess, the issues generated out there, but it poses a lot of problems. We put our position on this. And fortunately, our position is very much aligned with CHA.
That was my question, when you put oppose here, this is just a local opposition as opposed to CHA opposition.
Well, actually, with this,
To see.
Yeah.
the impact on rural facilities.
I'm still not.
this aligns, so these are my thoughts about, but interestingly enough, they align directly, they align perfectly with CHA with the exception of the seismic bill, which we're neutral on. Because we're down that path quite a ways.
In an urban setting, if someone does identify that there's a weapon, do you know what they do?
Well, there's different aspects and Sean can walk through the concealed weapon part where people are trained in what they can do with their weapon, as far as like securing it in their own vehicle and that sort of thing. That is the expectation. The CHA representative the other day on a phone call said that Oroville Hospital, Rob Wentz, their CEO, had implemented metal detectors at security in April, and in their first 30 days, they confiscated 300 lethal weapons. So what are, and we know what we consider lethal or what my definition is considered lethal, but I don't want to be collecting everything from every fisherman, hunter, whatever. We all want to, most of the CNOs on this call are in recreational areas. We don't want to get into this business
Right.
at all.
You mentioned working with the sheriff's department and highway patrol. Would that take the form of an MOU or thought given to that?
And that is being discussed, that we would have to enter into some MOU with them. Currently, our only expectation of them is that, they're going to assist us with someone who they bring to us under a 50. Other than that, I really don't know how much we could possibly expect from them, especially knowing how understaffed they are in this county.
Yeah, I get that, and it also, there's kind of a need to get them to take it seriously, sometimes put it in writing and.
I think they know that we don't cry wolf, so I think that they take any time, because we don't call them a lot. I think they take it very seriously and come to our aid as quickly as possible if they're in.
What was response times look like?
Well, and this falls, it's similar to what happened with COVID, where they had administration and healthcare adjudicating waivers. This is the same thing. If somebody comes in and let's say we have a metal detector and they have a legal right to carry, they've got a concealed carry. Now I have to adjudicate as an organization somebody's rights. So there's a lot of flaws in it. It's expensive. It makes no sense for us. It requires just a lot of infrastructure to do this. So I oppose it, but there's a big push for this, huge push. So we'll see where it
A
goes.
question about whether somebody has a legal right, if it's a hospital policy. That no weapons are allowed in.
CCW laws have changed. I just renewed mine. And just because I put it out there doesn't mean that I have a legal right to take that
Yeah,
away.
even my son, who's a Chico cop, he went down to go see my dad, who was in Kaiser Vacaville. And he's carrying, obviously, he had to relinquish his gun as he went through the door at Kaiser. They had to keep it for him.
Mhm.
They have the ability to-
That's their policy.
Yeah,
Until you-
not surprising.
Yeah, well, what's a policy if you can't enforce it? Is my point. I can have a policy, I can have it posted all over that we're gun-free zone, but it does not adjudicate, the policy does not adjudicate someone's rights away. You can trespass them and that's it. But do we really want to trespass patients?
He could have made a big deal about it, he said, he really could have,
I
but he
understand,
didn't.
but the he's coming in seeking care and they're carrying a concealed weapon and they've got the right to carry it, but I have a policy. Am I going to policy
So what is
away a
it?
person's right to?
Supersede, yeah.
What does the courthouse do? I mean,
The courthouse is off limits per CCW law. So there's law. There's federal buildings, schools, postal, anything federal. So it's actually in the CCW law in California that you cannot enter a courthouse. So it's baked. They have a law supporting it.
Hospital's not on that list.
No, they are not.
So what amendments is CHA suggesting?
Don't know. I didn't see the markup. They're all in recess. So I just wanted, I'm keeping an eye on this one because this could be pretty pretty expensive to us. If it goes through. So we'll keep an eye on it. The one I really love, if I can move on, unless there's any questions about that, is the community college nursing degree program.
Decided on some.
Awesome.
Yeah,
You know, granting the ability for a junior college to grant a bachelor's degree in nursing. Specialized program. So that way it really
it's
expands.
limited to the number of programs.
Well, yeah, I can't tell you how many they'll grant, but the fact is that universities are impacted by people trying to become nursing, and we have a huge shortage. So I kind of like this.
It is, it's being fought by the
Nursing
university.
is, oh, is it? Well, of course.
yes.
Of course it is.
There's a bill that kind of goes along with
I think
that.
that the resistance that comes from concern at the four-year institutions, concern that people don't have good writing skills, research skills when they come to the university,
Hmm.
and they're not wanting to see a four-year degree. Prince's looking for a four-year degree out of a community college, and that's the concern.
Yeah, it's,
Lack of research.
I think it's
Teaching,
Lack of
research.
good
It's all about
foundational skills.
Yeah, yeah.
I see it, I see it all the time, students in a master level program, where
yeah,
they
right.
don't have any command of the English language.
Yeah. Well, I mean, just from the pure healthcare perspective, the more training we can put out there for people who want to enter the business, I'm all for it. You know, I'm not gonna get on the side of, who's gonna lose money on this thing, but we have a serious shortage.
Would we take students then potentially from, say,
Feather River.
this Feather River or Boston?
I think we would train
Absolutely.
students.
But the nursing schools, including our local ones, they're struggling with qualified nursing instructors. who
Yeah.
have masters or
Yeah.
doctorate
Yeah,
nurses.
very difficult.
Yeah.
So, there's just not a lot of us
Yeah.
out here.
That's where this pairing bill is a bit of a challenge though, right?
Yeah.
Because it tries to mandate that you have to have.
Yeah.
Spaces for these
You do.
students and.
You have to have places to go.
Teach.
Right.
And there's capacity for
I
it.
mean,
Yeah.
absolutely, I'm
100%.
That's how we can try to go out.
Yes.
They
Yeah.
try us out.
Most places are not though.
I know,
It's true.
I know that. Yeah.
Okay, so really interesting legislation coming down. They're on recess. They're back on August, so we'll be tracking
The beginning of August or mid?
like the second week, I believe, in August. So we'll be tracking when they get back these things. My key focal points there, I'll just leave it there. These are my key focal points, although there are many in the organization. These are ones I'm really focusing on. The other reports will cover some other areas. There were regional activities. Jenny Matthews had spearheaded the option of what we call the gig workforce, the regional gig workforce, using that software. So instead of, if we have shifts that are not filled, we usually offer it with a bonus to our own staff, which is the right thing to do, but then we go to the contract vendors, right, which are quite expensive. Jenny saw a software, I saw a software, brought it to Jenny, and she's been spearheading this activity. That's a software that, I think I told you about it before. It's a software that we all get on, and there's comparable pay and comparable competencies. And then in the region, they can, if there's a shift that pops up, they can take it. And they can come and work at the different places. It's a software that tracks all that. I don't know, Jenny's gonna be leaving us, so I'm hoping that continues on.
So the temp agency is probably contract with that software or?
No,
They-
it's just for people like at work that a nurse at PDH and EPHC and MODOC and mayors, where we create our own sort of gig workforce.
That's cool.
Yeah, and we all use Cerner now, so that's kind of another thing that we can get a little further down. So that's something I'd like to continue to pursue. And then, of course, the regional mobile MRI is something we're very interested in as well.
So who all is looking at participating in the workforce
Well, it
option?
was everybody, wasn't it?
Yeah.
Yeah.
All the local hospitals.
I think the biggest thing, the biggest challenge will be deciding on the pay rate for the increase.
Yeah.
Yeah, that's always the biggest challenge.
Yeah. But it's kind of like Uber for nurses or
Yeah.
something, you know, you just stop in what you need and people can pick it up.
And I think it'll ultimately be a lower cost than the contract vendors by all means. So even if we have to come up a little bit for shifts that we can't cover
Yeah,
internally, it's a great idea. And it also, you know, I think it's just a great exposure to other areas.
Yeah.
So we're gonna continue to push on that regionally.
Yeah, I know we've been trying to get something like that in place for a few years, so that's good to hear that we're.
There's a software actually that really, I mean,
Yeah,
it's
that's
really
good.
okay. Nothing really else. I just wanted to add some more graphs. I think this shows what Steve's been talking about, and Brady's been talking about is just our volumes in general. In the clinic are on a solid rise. I want to go down to the yearly rollout. That gray line is our volumes, and you can see over the last 2 years, it's continuing to climb. And I think that this doesn't reflect July, but I can assure you that July is moving up as well. So
I like the schedules you added to kind of, I don't know
Just-
where you wanna focus.
that, look here, yeah, look
Cause this
here.
one, I always go, wait, January, we're not in December yet, but that helped me.
Yeah,
Remember.
Thank you. Okay, that's all. If there's no questions, I'll move on.
Great,
Thank you.
thank you, Sean.
Mhm.
Yeah.
Let's see, so we're still seeing COVID and a lot of GI illness, although I think we're on hopefully the downhill slide on the GI illness. It appeared to be much like a norovirus outbreak that we're seeing in the community and unfortunately among members of our workforce. So we've had many days that we have been scrambling for coverage across many of the specialties, but hopefully we're
On the other side of it.
almost done with that, but knock on wood. Let's see, on the EMS update, I mentioned this at our last board meeting, that the Elks had come forward saying that they were applying for this equipment grant, which they do every year, but this year they want to specifically give it to Seneca to help outfit the ambulance. So Jerry, I want to publicly thank you and Caitlin for coming out the other day to assist with doing that inventory. They ran through every single thing that Enlo had supplied,
Right.
not just it wasn't a bare bones ambulance, it had
Lots of stuff.
many supplies, but we haven't had a chance to inventory everything. We're trying to put a fair market value on what the contents probably came up to. I would guess it's probably in the $15,000 to $20,000 range of what we found. And we also were able to identify through that what the gap was between what was provided and what we will still be required to equip it with. As far as meeting NorCal's minimum equipment list, so mostly what is missing right now, as we already were aware, is the portable suction, the Zoll defibrillator, which is very high ticket item, as well as all of the airway equipment, that would be very easy to come up with. And then, of course, we already supply all of the medications and medication implements. So that would be something that would be very easy for us to do, but we are still looking at a fair gap. We would take that $4,000, no problem, and put it to good use. So, thank you again. It was really helpful to get that.
I enjoyed doing it. It was very interesting being able to see what all was there and you know, my daughter's an EMT, she kept going, wow, this is a really nice one. Wow, this is a really nice one. And you know, she was working for minutes, so they had decent equipment where she was. So.
Well, thank you again. I'm really hoping that, I know that you have plans to personally thank and love for the ambulance and the supplies, and I hope that we'll do the same for the ops launch.
Absolutely. I do need names for who I need to address it to for.
Sure.
Yes, thank you. And then what I can do, I can put it together and then I'll ask Deborah to put out on our letterhead.
Okay, sounds great. And then the final thing, we've had just a little bit follow-up survey, as expected. We were expecting the board of pharmacy to come today, they had scheduled today, and they canceled last minute. I don't know if it was a problem in reaching us because of the fires. So we still have that hanging over, and again, that is related to something that we reported and they need to follow up on. So we have more information on that, and I'll get that to you.
I think you skipped over or you were appointed as chairperson for Yeah, we
Yes, I
did.
was-
You skipped that part, didn't you?
Sorry about the ambulance, yeah, so, Sam Leslie was the, chairperson for the Plymouth County FCC in the last 2 years, his term is up. And, he asked me if I would step into that position, and given how involved we've been, with all of the different things happening with EMS in particular, I was happy to step into that role.
Thank you for doing that. That'll be a great experience.
Excellent, Judy, that's great.
Awesome,
That's it. Thank you.
perfect.
Thank you, Judy. The next up we have is Brady.
Brittany?
I'm here if you can hear me. Can you hear me?
Thank you.
You can hear me?
We can hear you.
Okay, good. So you have the report in front of you. And on the under clinic operations, section 1. So we're continuing on the process improvement as it pertains to the phone systems, the scheduling, the referring, all of that. We're still not where we need to be. We've improved. We will still have patients calling that don't get us on the first try and leave a voicemail and they call a second try. So we're kind of troubleshooting some of those things. We were, as I reported last time, we're using the pool system. We're meeting, they call the main number. The main number puts it in Cerner and you can actually track the message. And then the end of each day, you kind of have a timestamp of everything so you can make sure that everybody's called that day. So we've started that process probably about 2 weeks ago. And people are surprised that, towards 5 o'clock, 5:15, they're getting phone calls because myself and Jessica before we close out the day are making sure everybody gets called. But even with that system, we're still getting, Sean had somebody come. We're still not catching them all. So we still have work to do, but it is improving. In the cross-training of the staff within the clinic, we're trying to cross-train everybody so that everybody is familiar with every position, just in case if we have to flex. And then working with Judy in like the LVN realm, we're starting to cross-train across clinic and hospital in the clinical FTEs. So that's good. That will give us more flexibility as we have, people going out for one reason or another. So that's continuing. In our MA program, our first MA, probably by the end of this month or first part of next month will be completed. So we will probably have a little potluck as a ceremony for that. And as it pertains to Linda's section, so Linda's always detailed in her reports to the board. As we've noted, there is one thing that's not in that report that Jerry is aware of. Our AC unit for the clinic, which is the outbuilding next to the clinic, has been very loud. And so we've had that unit, I don't know if Linda's here, but we've had that unit kind of repaired several times from bearings in one of the flywheels. So we're getting out the repair people that we use for that. We're greasing it up. So that's probably one thing that's not in the report that just be aware of. And the other interesting thing and kind of cool is every year we do so many either providers or nurse practitioners in a training period. Our last student that's committed, we have a lot of people still reaching out for rotations of primary care, but our last student, his name's Scott Wu, will be here on Monday for 4 weeks. He's a 5th-year medical student out of Northwestern. And he called Sean And the reason why is his grandfather has a place up here. And so all summer long, for many, many years, he's been coming up here. So he wanted to kind of come back to the community and really, work in it. So he'll be here Monday. So if you see a new face, that's him. And then when it comes to the end of the report, where the providers, we have extended an offer out for a nurse practitioner. And so we're still working with Jenny, Sean, Judy. We're still working on that, but an offer has been extended. And if everything goes well with that offer, that nurse practitioner will come on in November. And then in our, and Judy, did you touch on the ER at all? No.
As far as the providers coming on,
Yes.
no, I did not.
Okay, thank you. So we have, so we're in the month of September from a scheduling standpoint. And as we reported before, we had one provider add this month in July. And it's one of the Enloe providers. We will have in September another provider add. So we're starting to build our bench strength, and this is working with Dr. Nielsen and building this team. So probably by the end of the year, we will have a steady core of docs, on the schedule, which is great for our community and clinical care and all sorts of positivity. So that's the report on that. Our providers that are here now in the clinic, a lot of good feedback from them and a lot of good feedback from the patients and the staff. So a lot of positivity there. So fingers crossed. And then when it comes to medical equipment, we did order the Stryker tower that was approved last board meeting. And so the PO was cut. Now we're looking for the delivery date. We're working on all of that stuff. And that will take place of the loaner we've had for longer than the loaner period. So kudos to the company for helping us out there. And I believe the next thing we're working on obviously is the ultrasound, the other piece. We haven't cut a PO yet. We're still working on the package that we owe the board. And I got to have our ultrasound tech kind of review all the parts to that, making sure that everything is exactly what we need. When it comes to EKG machines, something that, and Judy, did you bring this up? Was that a no?
No.
Okay. Thank you. When it comes to EKG machines, this is not in the board because this is happening in this last week. We've had a couple of, and I always like to just, things that are coming up so that you're not caught off guard. We've had a couple of our EKC machines, right? EKG machines that have went out for one reason or another. We have 4, and correct me if I'm wrong, Judy, but 4 in the hospital and 1 in the clinic. And so we're working to get those up and running. 2 of them went down, or this last week, and 1 of our units went down. We're ordering the parts, but that's probably an area that we're working towards to get back in solid standing, because obviously you need those units. But the good thing is our teams are, the one in the clinic we obviously don't use on the weekend, so we're moving it over to the hospital until we get the ones that are down fixed. And also we're working to get a loaner in here so that our staff have everything they need to keep our patients safe. So that is my report. Are there any questions?
I have a question, Brady. This is Shelley.
Hi, Sean.
So, hi. So, regarding the Cerner frustrations that
Yes.
were, yeah, that Dr. Jensen and both Dr. Ware, were very vocal about at that one meeting we were at, and it was a luncheon.
Yep.
How is that going with those, specifically those two physicians that were so frustrated?
Well, it's going well, and Brian can probably talk to this. So, when you have a system like Cerner or Epic or any of those things, there are people that are trained in the IT world and then the clinical world, and they are actually the helpers, like elbow support. That if you're having those issues, there's somebody right there that knows both worlds, that can do that. So we brought on, and I can't remember, it might have been
Bree.
no, it was 2 months ago we brought Bree on.
Yes.
Yeah. So, and it's taken a while to get her up to speed. But she's already having an impact because I meet with Dr. Ware on a monthly basis. And, and she will let me know if things aren't working. And it's been other things other than Cerner that we've been talking about, because she says Bree has those things handled. So the elbow support that we're giving her, and Brian, do you want to add anything to that?
No, the clinical staff is definitely much more willing to reach out on demand than they have before. Bree has definitely established a great relationship, going down whenever they need something, especially, with Dr. Ware. Sarah got a good relationship with Heather and Dr. Russo and Lori. So, Dr. Finity's been great, coming through, so it is definitely a different working
Dr.
relationship.
Jensen, Dr. Jensen was it sounded like a workflow issue. So, I mean,
Yeah.
Cerner surgery is
Man.
difficult.
Man.
Yeah.
Part of what I hope to streamline is his surgical care set is 30 pages long but he knows the CPT codes buried in his head and they're numerically listed. To me, it makes no sense at all if you're looking for a procedure or, when you're doing your professional billing and things of that nature. We did some workflow with him, so he doesn't have to carry his laptop into the room, so he can log into his room. So it's he was a kind of a trial with that. That seems to be working. I replaced his tablet like this with a full-blown desktop, and his Dragon is performing much better.
okay,
So, we're taking care of chipping away
okay,
at things. We've had some weird cases that he's had to deal with patients that have had to be transferred out, some weird workflows that aren't typical for us here.
okay,
But we've got those kind of nailed down now. Usually the patient is an outpatient, when they go home, they don't have to become an observation patient for a while and get transferred out. So
Right.
we've had
Right.
a couple of those weird ones that have happened that the staff had to work through, but no, he will reach out to me. We got it.
oh, good, good,
Yeah.
Same thing, on Tuesdays with ortho.
okay,
They just not.
okay, good, it's good to hear, thank you,
Yeah.
thank you, Brady, as well.
Yeah, and kudos to Brian's team, because I think with this new design that he has and all the expertise that he has, we're moving the ball in a lot of areas when it comes to Steve and the finance. I mean, and that's when you have a system like Cerner, you have to have the experts that can deploy very quickly, because there's always something. And Brian was out for a little bit and his team performed beautifully as Brian was trying to make its way back across the country. So it's a tribute to their work and their expertise. And that's it for me. Thank you.
So Brady. This
Yes.
is Jared. Can I ask about the portable X-ray?
The portable X-ray. Okay.
Yeah, because in your report, it says that it looks like the batteries may need replacing at some point, and I'm wondering what our lead time, if we know what our lead time might be on that, and if we would consider maybe replacing the batteries sooner rather than later, because, we could always use this unit, probably in Ortho or something like that later on down the road once we move, so I wanted to ask about that.
Yeah, usually those, I mean, you can get those batteries pretty quickly. I mean, they seem to still be performing, because Todd's watching, watching them. But it is, I mean, portable x-ray is very important, for all sorts of things. I'll ask Todd just kind of where we are in the life cycle, and we can start looking for, a unit and just kind of price one out so that we're ahead of the game a little bit. It's a good idea.
Yeah, I just thought I'd follow up on that just because, some things that we can get pretty quickly and other things, if it's older, maybe not so quick, so I
It's
just
an
wanted to ask. about that.
AMX4, should be able to get it quickly.
Yeah. Okay.
I think that's all I had. Anyone else? Any questions for Brady? Thank you, Brady.
Thank you.
All right, next up, Ryan.
So, it's been an interesting month. The heat wave was a bit of a challenge for us upstairs in the ballroom. Like I said, we really, right after 4th of July, we took days to get that room, so we don't have to keep an eye on it all the time. It was just, it was brutal days. And then we by accident, we found that, restricting, trying to extend the pipe to get the heat out of the room. Like the pipe we can get here in Chester was 4 inches, not 5 inches, and it impacted a lot of the airflow that we didn't even realize until we did some testing on it, keeping an eye on that. So that room's rock solid now. I can sleep at night, everybody can sleep at night, when it doesn't come in the windows. But like everybody said, I was on the East Coast when CrowdStrike had their event.
Oh, gosh.
And the team got through it, part of Cerner, their Oracle, their Unix based on the back end, so there were third-party tie-ins that had some issues with them, but it wasn't a major impact for us operationally. Fortunately for us, there, Mass General had to shut down. I think Common Spirit had shut down. Another big change that had a bad Friday, Saturday.
You have a hard time getting back?
Yes. Yeah, 23 hours on Monday.
Oh.
Yeah, but, after being canceled a few times. But, that was okay. A couple of things that we're working on, the Vizient contract, the Sean and Steve Stoops and Steve has been working on, looks like it's gonna pay off on us on the IT side. We hadn't completed the printer contract that we talked about earlier in the year, because we held up for cash flow reasons. We potentially are looking at $100,000 over the term of the contract savings wise now. So that's, that's kind of our.
What does
goal.
Vizient do again?
Group purchasing.
Purchasing?
It's like Premier,
Yeah,
except we went to Vizient.
I think we did too at North Bay.
Yeah, so, rebidding that out.
That's
So we're waiting for the lawyers to review the contract on that. We'll
Yeah.
definitely save us a lot of money. We're chipping away at our dependence on Apex. My last call with Apex Wednesday, we only had 4 tickets with them. So we're really not dependent upon them anymore. So my next step is trying to work with them to pull what we pay monthly per PC for them to update and take calls on back from them. So that's it's our monthly with them is like $24,000. And most of that's in how much the PCs they charge per PC and how much they charge me per server. And we try to keep an eye on what's going on, because every PC we had is close to $900 a year in support with them. So we want to start peeling back which ones that they're supporting. We have to do a lot of hands-on anyways. Sometime next month, I'm going to have the staff not reach out to Apex, so we're frontline. And then I can really get my handle on really where Apex is, and do we have, Ethan's really come up to speed on that with his knowledge.
and spreading out to Sarah and Bree, we're handling anything desktop related internally. So we're hopefully only going to be using them on back-end server, network kind of things on that side. We've got a couple of big projects, like we had to install Windows 10 back before I started, because that's all limited ran out. We have to go to 11. I'm not paying Apex to do that upgrade for us. We're gonna handle that internally, because that would be a $50,000-$60,000 service bill from them. So those are the type of things that we're looking at the IT sector to, not be spending money on to.
So do we lease our computers?
No,
We buy them?
yeah,
So isn't it cheaper, to use a laptop and a docking station and use that as your primary PC?
Most people.
yes and no.
Yes and no?
Yes,
Depends.
yes and no, depends on the person. There are way too many laptops on here. There are laptops that never leave where they're going. So, because when Apex came in here, everything was a Surface Pro. So they got in their mind that it needed to be portable.
Mm,
It really doesn't mean, the problem that we're having is these USB connectors now.
mm,
The Surface Pro had a designed docking station that with a mechanical connector that came in and came out. These USB in the docking stations, we're having a lot of problems with. So for people to take them home or people to take them into meetings,
yeah,
yes, that makes sense, and we have that there, but there are ones that never leave people's desks.
Oh.
And also the performance, like I talked about, Dr. Jensen had one of these, never left his desk. We replaced it with a desktop, and he got better writing performance out of it.
mm,
So that's where we are right now. We're not going to have to touch machines for 2.5, 3 years. We're just what I'm doing is shifting them around. So if I
Yeah.
find laptops that a desktop would be better suited on, we have some backup, so I'm kind of
Yeah.
rotating them
So
out.
it'll coincide, the refresh will coincide with the move to the new building.
Yeah.
And not everyone's gonna get a laptop.
yeah, it was supposed to be a huge savings for us at North Bay. Nobody had PCs anymore. Everybody just had, but that was like 3 years ago, so we all had docking
Yeah,
stations.
well,
so. I'm not IT,
these-
I'm just asking.
Yeah, no, please, Steve, cover your ears, talk about this. The small PC, 2 monitors, keyboard, mouse, that workstation, $1,100. $1,700, $300 docking station, $200 monitors. Yep. It's not cheaper.
Yeah,
It's only cheaper if you're eliminating giving somebody 2 devices.
well, we just released them.
Yeah.
I'm all about, if you're not mobile, it's a desktop, it's small form factor desktop.
Yeah, the
If you don't need to take it home.
it depends on the number of machines you're dealing with. 'Cause
Yeah.
if you have
We were,
thousands of machines, and you have to go from Windows 7 to Windows 10 to
Yeah.
Windows 11. That's where leasing makes
Yeah.
sense, because you get new.
yeah, we were in the red, we were looking for every way
Yeah,
to cut
no,
costs.
my experience with these is, well, they've got a 3-year warranty with them. We'll run them for 5 years, so we'll
Okay.
have 2 years where
Right,
we'll extend the life cycle, and only when we start seeing significant kind of failures where we kind of address what's
okay,
going on. But my last place had desktops that were 10 years old. The workload for Cerner, just being a citric session, not very much on the machines.
okay, thank you.
Yeah,
Well, when did we leave Premier?
We left them,
June,
in
right?
May.
And it was significant savings.
Well,
There was a couple, yeah, there was savings. We, rather than, so we are an affiliate. We don't have a direct, we're not big enough to have a direct Premier contract, so we stayed with our affiliation with Adventist, and they switched from Premier to Vizient, along with, 12 other major organizations.
So we're affiliated with Adventist Health?
Yeah, so we're a Vizient affiliate.
so we get their price.
We get their pricing. So, which obviously is great, because they get a lot of stuff. So we get their pricing, and it did prove to be a savings for us.
Yeah,
And
there was sorry, Rich.
go ahead, just wanted to know the range of the savings that we expect.
Not ridiculous, it wasn't an astronomical savings, but what was it? 4.5%?
Yeah, I wanna, I think the initial, so they analyze everything, your buying patterns and types and all that stuff. And then the project started at the first of the year and the transition was in June. And it's like for like initially. And so there was a savings, like 3-4% in the initial transfer over because of their buying power. Vizient is bigger than Premier as a GPO. And then what we're doing right now is post go live is we're looking at products that are like products, but maybe are different. And so the next part of the project is going through doing those crosswalks and seeing if there's like products, even with a deeper discount. And so that's the second half of the project that we're doing. So there should be more savings. And like the bed, we ordered one skilled bed, I think it was a month ago or a month and a half ago. And there was, when we priced it out with Premier, and I'm making this number up, but I can't recall it. It was, let's say $2,400, $2,400 or $2,600 under Premier. And it was, a couple more hundred off through Vizient. So their buying power is helping us.
Okay, thank you.
Thank you. Anything else, Brian?
No, the ER docs that have been coming in from Enlo have picked up Turner right away. Needed very little support, but great to deal with on our side as well. I was in the Chester of Maine when Friday happened with Microsoft, so I had no cell signal. When I got it, finally got a hold of my team, I was glad that, they weren't in panic mode.
That's right.
Yeah.
I like the hell down the floor.
Yes.
Thank you. All right, next up, Jenny. Tell us work.
So, I can be here for questions, just to highlight a couple things. We have a visual page. I don't know if you're all able to see it, but it got second place, which is awesome. Chelsea spearheaded that and she did a fabulous job. I just included pictures because there was staff there, but she did bulk of it and it was really helpful. So great job, Chelsea.
Yeah, it turned out really nice.
We worked with Diamond Fab, Percussion, and Chester Little League on the float, and they were great partners. That was really nice. And then we've been interviewing a lot, which is really great. We're receiving a lot of applications. So that has been wonderful. And we've really been trying to fill some per diem positions, especially in nursing, to train backfill. So that's been really great. Do you guys have any questions?
It was great to walk into a crowd of 8 staff for their orientation.
Yeah, that's
8.
really great.
I mean, that's the biggest I've seen since I've been here. So good job.
That's
Congratulations on that. I mean, it's so fun to see 8 new people joining.
Yeah.
A lot of them were per diem and things like that, but
Yeah.
still, it's that bench strength.
That's actually really helpful for the per diems. I mean,
Yes.
full-time staff is great, but per diems are the ones who really help out.
That
When they have
bench.
sick calls, vacation.
Yeah.
I loved your
The human touch, yeah. Human connection.
comments and everything. I just want to put one. Any questions? Questions for Jenny? Okay, thank you. Okay, Chelsea, you're up.
Okay, so in the report, just to highlight a few things. So we have several different marketing based campaigns going on. So we have the Welcome Welcome Seneca campaign that we're still doing. And that is where we're trickling out information about our staff to, like our managers, our directors, to the public through social media and different print media formats, as well as the radio station, to get people to feel that connection to our staff. We also are doing a campaign for providers. So we are also with all the different medias, radio, again, print media, and all the digital media, pushing out the providers we have, the services we have, that we're accepting new patients. All of that is, part of the campaign that we're doing. So those are the campaigns that are constantly in the background. We also throughout the summer have been working on some geofencing, as well as ads for that are geared towards the tourists that are here in the area. So
Have you noticed any difference in volume that you can attribute to that?
So one of the results that I've asked if we can get from geofencing is where if the ad has pinged on their like their IP, then if they come in here, it's gonna show us the thing that it will also, right now, we're trying to not target people that are here primarily or people that work here or things like that, because then we're just paying for staff and people to see ads. We're trying to target those that don't have a connection here already with the geofencing. But that is something that I've asked if they can implement, so they are looking into seeing if they can do that, because that is something that they should be able to do, is show like, okay, it pinged here, like it came into your radius.
Well, how would they show success? Otherwise,
So it's by numbers, or by they show how many people clicked on your ad, how many, like how many views you got, things like that. But what I would really love to see
Yeah.
is, okay, we saw these
Connection.
Yes, so is there any increased direct connection, which would be great to see, but even if there's not necessarily that direct connection right here, right now, what happens is those people that saw that ad, well, they were visiting, next time they're visiting, if they need our services, they might be more like, oh yeah, I remember there was a hospital, there was a clinic, it's in Chester, and that'll more prompt them to look it up there and check it out.
But Brady showed me a really interesting, sort of graphic analytics he were able to pull from Cerner, and I found it fascinating where it reason for visit. You know, and it pulls it up in the graphic, showed that, Brady can help me out here. I think that establishing care was number 3. So some of it was like your reason for your visit was a prescription refill, which is a lot of them, right? A lot of people, stuff like that. But I think, was it 3 or 3rd or 4th to 3rd to the top was establishing care. So we are getting a lot more people establishing with us. So that's that, you know, coming home thing.
I'd love to see that report.
Yeah.
It's really,
Monthly, I think that's exciting.
he was playing with.
Well,
Cerner. I was like, wow.
Yeah, no, there's a, it's called Access. There's all these different reporting tools, and so there's one called Access, which is a newer one. And have you ever been to a conference where they ask you a question and this mosaic of your answers populates on the screen? And that's what Sean's talking about.
Most popular is bigger.
Yeah, and whichever one's bigger, but it is a mosaic of words, and whichever one is bigger is the more responses. And so we're trying to fine tune it a little bit, but I'll bring it, or a couple of those things. Now we're a year, past the year mark, so that the data is, your in value of the data is stronger, so it's truer. But I'll start bringing some of those on each board meeting, just so you can get a flavor of what the tools can do. We were working on the zip code one too, and it has the report out of one of the systems was like 157 pages long. So we got to refine it down for the board. But we'll start bringing that each board just to give a little flavor of what it can do, and then you can say, hey, we like to see this, or we like to see it this way, because there's a lot of different ways to view the data.
Are those canned reports that Cerner provides?
Yeah, they're canned reports, but you have to run them on a date range and certain data points that you have to run them. So it's not, so you'd have to physically go in and run it for a specific date range, on the types. But I'll bring some as examples.
Too much work.
And then you can say, well, I like to see this, or I don't want to see that, because there's a lot of ways to look at it. But the mosaic is kind of interesting to view.
Sorry, you had just,
No worries, thank you, Brady.
okay, so our students finally recorded their ads for the radio, so those will air August first, so we got them in there, and so we had two students that won, they were, the two that won the ad writing competition, they didn't record the ads that they wrote, because they wrote ads for July. And so they recorded ads for this fall, and they turned out really cute, and you'll start hearing there's 3 ads all together, they're gonna rotate next month. We're continuing with all of our usual marketing. We are working on its phone book time again, so that happens every year. We have to comb through everything, make sure everything looks correct and is good to go.
Make sure it has our updated phone number.
Right, yes, so, updated providers' names, because sometimes people look under just the clinic, sometimes they look under individual providers, so all of that, we went through a lot of pages for that. Digital marketing, event marketing is still going on. We are sponsoring, the band shell again in Labor Day. So that's our next time at the band shell. We'll have the table there, we're sponsoring the prize. Sean will be there to get on the mic and talk to people. And the rest of the executive team, if they can be there, they'll be there as well. And any questions so far? Okay, otherwise we've had the press releases for Finerty and Hartman released, so those are the providers. And then we will be releasing information about the new build. We are waiting until we have a little more information to release, yes, so, but that is, as soon as we can, we're gonna share information, because that's the big question right now. That we're getting from everybody in the community is, what's going on, when are we starting, so that's something we're gearing up for and ready to do. And then one of the things you guys are gonna see, we're gonna start putting out information on our ER providers. So just like we have let the community know who our providers here are in the clinic, we're gonna do that with our ER providers too, because that we feel like it'll help with people, feeling comfortable with going to our ER and knowing that we have all these qualified providers, and so that's really something new. Our neighbor letters, Maywood neighbor letters went out. We have letters ready to go out once the contract's signed for Reynolds Road, as well as another neighbor letter that will essentially say, hey, you now have a week left, like, make sure anything that you want, you try and get it off of the property. And then we're gonna be doing updates to Wildwood, so, you have the first update in here. But that is gonna be the format we use to update the residents of Wildwood on a regular basis as to what's going on. So we've been requested to give them an update as much as possible. And so that is.
You know, aren't all of the ER nurses, the nurses that work in the ER, aren't they MICNs?
The ones that are our employees. We're still, using a traveler, on night shift and part-time.
Okay, and that's also an amazing talent too.
Right,
Some marketing,
right.
MICNs.
That's a good idea. She's suggesting maybe, that as part of the get to know our.
Yeah. Get to know our staff and introduce some of the ER nurses as well. We can do that.
That's very
Good
good.
idea.
And then Chelsea, I just wanted to make a comment. It's all awesome. If someone could perhaps just do a quick check on our agenda minutes page, I think there might be, I had gone and looked for something and it was like the wrong date, and I don't know if I did something or if there's maybe something there, so
Yeah,
if you don't mind, we will check that, thank you. And any other questions or comments for Justin?
Nope.
Thank you, Justin. Okay, so that moves us on to the compliance HIM, we don't have that for Larry. So now, see.
So the update is, Western Alliance is scheduled to provide the final approval for interim financing on Tuesday, and they had to reschedule the meeting because of.
Global strike.
Available. So they will meet next Tuesday, so the 30th. They did write to us and said this will not affect the closing date.
It's on track for our August.
One thing yesterday they reached out to me, and as someone raised this, they said that they noticed that 4 of our board seats are up for election this year. I don't know if we can talk about board members governor's intentions and all of that considered campaigning or whatever it is, but they're curious if we anticipate turnover in.
We can provide an answer to give to them.
Okay. And if somebody could.
Yeah.
Reach out to Sherry. That's all I have.
Thank you, Steve.
Mhm.
All right, that moves us into number 9, our appointment to Chelsea with our Seneca Healthcare Foundation report. Number 9.
Okay, so you guys have some packets of information that I gave you, got the perspectives, and then it has some pamphlets in here. First thing I'll start with is if you guys have any questions regarding the initial foundation report. Okay, so we are focusing on the, still dialing policies and procedures, working on all the logisticals, Blackbaud software, it's still implementing that. And it's going well, but it is, there's a lot to it, because we're trying to make sure it's all good data that goes in and that everything's correct. We're combing through data, making sure we've got names spelled correct, we've got addresses, all that stuff is correct, because the last thing we want to do is send somebody a thank you letter and it's the wrong name. Yeah. So, we are still waiting on our official 501c3 status. I cannot launch the merchant service side of Blackbaud until we have that status. That is what allows us to take like payments online through Blackbaud. In the meantime, we do have our PayPal. We can still accept it through PayPal. It's just not as good of a rate as Blackbaud, and it's not as easy like with Blackbaud. It automatically goes, like, here's who did it, here's it, so it logs it all. Whereas with PayPal, we have to then go and log it in. But what we can do is get the dashboard of Blackbaud up and going until our 501c is up, and we can still start entering those people, entering those donors, so that we are tracking those donors, we're tracking how much they've donated over time, so we know what level to recognize that. So with that, going into the donation, so what you see in there, there's a naming opportunities sheet, and so that is essentially, those are the different things in the hospital that someone could possibly name. And those are prices that, like, those are figures we worked on with staff and with people as part of the foundation. And so that is a draft of the naming opportunities and what will essentially be an insert for the prospectus. So that's something that one of the tools will have. Another one that we're working on is sponsorship opportunities. Sponsorship and naming differ, and naming is something that is there long term. It's forever. You're naming a department, whereas sponsoring, you might sponsor the artwork or sponsor something that is not there forever. And those are going to be smaller ticket items that maybe will open up those sponsorship opportunities to more people. With that, our donor designation level. So you have something that shows draft. So this is where the direction we're heading with donor recognition and donor designation. So we have the up to $4,999. So everybody who donates, regardless of what it was, is going to be recognized in that donor level. So that's our Quiet Meadow donors. And so that one is our first level where we start. Then we move up to our Forest Edge donors, then our River Run donors, our Infinite Lake donors, and our Mountain Peak donors. So all those different levels, we will track with our software where people are at. So if they donate $100 a month or whatever, then they might eventually move up. What we are still working out the logistics on is how we're going to recognize those people as they jump levels and change all of that. So that stuff we're still working details out for. But the important thing here is everybody will be recognized. Now, with that, we are talking about
Recognized how?
that's.
We're talking, you just.
That's what I'm going to do. So with that, we are talking about our donor walk. And the new hospital will be where everybody who donates is recognized. We're looking at the options of a digital board. So digital donor walls, and there's different ways that these are done. Sometimes it's multiple screens or it's one large screen. That is something that we still have to get the pricing on to figure out
which would be the best route to go, but long-term viability, having the digital donor wall will be easier for updating, easier for maintaining, because we had a few issues with the leaf and tree design. So first of all, finding a tree that looks good with our area, but still looks professional and doesn't look chintzy has been actually quite hard. Because we have a lot of pine trees in our area and we can't inscribe on the little, like, we can't get a little pine leaf to inscribe on, so then you're inscribing pine cones and things like that. Also, and recently talking to MoDOC, the company that was producing their leaves went out of business, so now they have a new style leaf. And so there's just things like that, so the digital donor wall is something we're looking into. Nothing has been set in stone as to what we're gonna do with that yet. But the idea is with the digital donor wall, we might have the quiet meadow donors, and so we'd have a picture of a meadow. And then all those donor names are rotating through that picture in like a soft fading way. We're not gonna have, as Sean said, no Vegas,
No
night.
symphony.
Yes. Our forest edge, again, we might have a picture of the forest edge with those donors all listed on there, and River Run, Infinite Lake, Mountain Peak, so as you go, those different pictures would have those names on it, so that's one of the thoughts that we've discussed. And so, yeah, any questions, any comments?
Well, we have friends who've been asking us,
Right.
every week,
Right,
so when do we expect it to be made public, or is it gonna be a mailing, or?
right, so, once the foundation board approves the final, like the names, the levels, everything, then we can go with making this public. We will be giving people, obviously, the sheet will be available. It will also be online. We will be sending out information about the foundations, how to donate, and the donor levels. To the people that have already donated, we will be doing a specific letter to them to let them know that the value they've donated will go to the appropriate level. So we will be making sure that those people still know that they're getting recognized. We haven't forgotten about them, and that they will be in this level. What we don't want to do yet is tell them how they're gonna be recognized, whether it's digital or whether it's on the tree or the leaves, because that is the questions we don't have just yet. And once those new build meetings start up again, then we can dive into that with the signage company and with all of those companies as to the logistics of how that can work, because we want to make sure it's feasible and that it's something we can do before we tell donors. So right now, we would just be giving out, here's the levels and the possible ways we might recognize this.
Are you gonna be mailing it to people?
Yes.
Live here, or, okay,
So we will be doing mailers. So the mailers will have information on the foundation. It'll have information on how to donate. Those mailers will go out closer to the giving season. So they'll go out closer to like end of fall.
great.
And I like your report too, Chelsea. It all looks very, very nice, very professional, and I love how you put your financial status in here and everything, so we can kind of get a snapshot and think, it all looks really good.
I've got a question
Yeah,
of, the wall, or whatever we're gonna use to recognize people.
right.
That's not the foundation wall. That's Seneca Healthcare wall.
Yeah.
Right?
They donate through the Seneca Foundation, but it's
Right.
Seneca's wall.
Yeah. The decisions, the final decision of what
Right.
is not the foundations.
No. That would be I would think the new build
The design team.
design team, the team that like.
Approved by
yeah.
this board,
Yes,
right,
yes,
yeah, because I just wanna make sure
The
that.
cost is gonna be
I
Seneca's.
think
cost.
you kind of said, when we were talking about the naming opportunities and so forth, was gonna be approved by the foundation board.
well, the naming opportunity, that's the fundraising, but then that still comes to this board.
Yeah, it hasn't been approved by
Yeah,
the
it
Seneca.
hasn't been.
Yeah, I
Foundation
understand
Board
that,
yet.
but, okay, so the foundation board may recommend that this,
Right.
and this board will make the final
Yes.
approval.
Yes, this board
Got
will
it.
make the final
Got it.
approval, so the foundation board, once the foundation board's done with this, then that's when I bring this to this board and say,
Excellent.
can we get final
Perfect.
approval for this?
Yeah.
So, yes,
And I think, Rich, to your point, you know, if any board members have any feedback on this, I
That's why it's
imagine
being
Chelsea
put
would be happy
Right.
to sit with you or take a phone call on it.
Right now, I have no idea whether we have whales in this community to spend this kind of money. I have no clue whether this is realistic or not. So you guys do, but I don't.
Yeah.
First, Shelley mentioned a few minutes ago about sending this information at some point out to everybody who lives here. And I just wanted to expand on that a little bit, and hopefully we can send it to people who are part-time here
Yes.
as well.
Oh, yeah.
Yes, so we would send it to, so when we pull the county list, we pull both primary and secondary residents, and so when we do the mailers, they go out to both. So, yeah, it's beneficial to go to.
And also
both.
Blackbaud is being
Yes,
built with all of these addresses.
right, so, and Blackbaud has an address finder, which will help because our county addresses
That's
are.
what's my next
They're
question.
horrible, so
Yeah.
with Blackbaud, we get to do an address finder once a year. We can do it more than that, but there's a fee to do it, but it updates their most current address
Only in
for those people, so.
Only in town, so that was my other question, is if these would say, you know, resident of, and then the address, or if we're actually gonna try and put these names on the communication that comes.
So for the communications that go out with it's a mail merge, so you basically program it to, and it'll do it all through Blackbaud, but it's a mail merge where you program to, it says name, and then it's gonna insert the person's name, so it's gonna say, dear Sandy and Bob.
But that's where I wanted to make sure we weren't gonna be basing it off of the county
No,
information.
we aren't gonna
because it
base it off
probably
the
is like
county,
5 years
no.
old or whatever.
So
Yeah,
we will be utilizing Blackbaud for that because their software.
it's more updated.
And they also have a deceased finder, so it'll find any deceased records, which the county is not very good at either. And so all of that will help, but yes, yeah.
Thank you.
Okay, I have another question.
Yeah.
Will we have an opportunity in the future to allow small donor amounts so that we can get many people in the community who do not have the resources
Yes,
to be recognized? Because we don't even talk about that here.
Well,
Well, we do.
0 to 5,000 is everybody. You
No,
give $2.
what I'm talking about is promoting. I
An
came
event.
from the Goose Bay Hospital where they had on their wall, $250 donation, you got recognized.
Right.
Everybody in that community, in that small town up in Oregon where I was visiting a couple of weeks ago, you know, wanted to see their name somewhere,
right,
and it was $250.
right.
know.
So with this Quiet Meadows donor, their name will be on that, so that portion of the donation. So the different donor levels will be recognized on whether it's different screens or whether the screen is designed where you have different portions of it. So the idea is those people, their name will still be up on that screen and that wall. This category is probably gonna have the most donors, so it's gonna have the most names. And then as you go to the higher levels, you'll have less and less names on those screens. And under those categories. Does that kind of make sense a little bit? Am I explaining?
Well, yeah,
So Richard, $250 donor and $500 donor, those are all gonna be recognized on the Quiet Meadow donor screen. So they will have their name on it.
Even $10.
Yeah,
Yeah.
even $10 will be
well,
recognized.
I'm not sure we want to promote the $10 donor. I'm saying that the I know I have a number of plaques and different things that I've donated to, whether it's a zoo or whatever this. And they come out with a number, whether it's $200, $150, $250. I've never seen one that said 10. But
I think
That's
we
the-
should. There's a lot of people
Really?
that don't have much money.
okay, I'll
And
rest.
for them,
I'm
$10
just- I'm
is
just
a
thinking-
lot of money.
I'm just thinking that the first level is really inclusive of anyone that gives to
Yeah.
anything at
Yeah.
all. From $10 to up to 5,000,
Or $10.
they'll be recognized.
Yeah.
Yeah,
The
I,
only thing that's not completely clear to me, Chelsea, is, so let's say someone, donates, $15,000.
Right,
They're still in the George's Edge.
yes. So
They
they,
have to be ranges.
right,
So.
put ranges on there.
So it sounds like there is no minimum, it could be, whatever, to live in the meadow. But I want to give 15,000, is really a range.
Right.
Up to
To-
between
525 and 24, $9.99.
And we can do that. We can add ranges to this so that it's more clear that if you're donating within those ranges. And then something to note too is, so let's say someone sponsors a room for 25,000. Well, they're recognized in the River Run donors, but they're also recognized with a plaque at that room. So that there's different ways that those donors are recognized. But the digital screens, if that's the route we end up going, that will recognize those donors the same way a plaque would. So those names will still be there. And then the nice part is we can
Cumulative.
easily update those.
And it's cumulative.
Yes. and
So if
it-
somebody gives 15,000 one year and 15,000 next, they go up to River Run.
And software will automatically.
Yes, it'll capture, so it has attributes and it'll capture where they are, and then if we do each year, if we do like a donor dinner or a donor banquet, whatever we wanna call it, then that's where we can recognize this
Celebrate.
person has,
Yeah.
they have moved
Get
from
more
the Quiet
donors.
Meadow to the Forest
Run.
Edge, yes, so this person has moved up, and then it's a way to get people excited about those cumulative donations, and they might move up.
That's good.
So-
And to Rich's, at Enloe, many employees, did a payroll deduction.
Yep.
So if I'm getting $100 per each payroll, it may seem like I'm not giving much, but at the end of the year, I've actually contributed quite a bit. And so I wouldn't want to exclude someone because we want to accept donations in any.
Right.
Yeah. And I know Chelsea's exploring that with Enloe's Foundation.
Yes.
Can staff give to like a charity care program here?
So actually Kristen
let's say.
in finance is working on with our payroll, where staff can do deductions from their payroll to go towards,
Charity care.
yeah, well, it's charity care, we use the term charity care for like our,
Help pay for people that couldn't pay. the
Right.
bills or couldn't get care.
so that one, I don't know if that's an option.
Currently,
If what?
that's a no currently.
Yeah.
That program.
But that might be something that is possible because
We'll talk to their landlord. Yeah,
they go to a pool for other employees and then.
it went for people that were uninsured, underinsured, that couldn't pay for their care. So I think I gave to it for like, 20 years. Percentage of my,
Yeah, what we're developing with, what Kristen's working on is where they can do deductions to donate to the foundation from their paycheck. So if someone's like, I wanna donate $5 a paycheck or whatever it may be, then those people can still be part of the donation, the excitement of the new build, and then it adds up over time. We're sure getting the policy behind that in place so that they know how it works.
Is that pre-tax? No. No.
What if people want to donate, anonymously?
And yes, people can donate anonymously too. And they just have to let like us know, or they have to mark that it's anonymous, and then our system logs it as anonymous. And so then those donors, they're not put on the wall. or
And that
anything
does
like
happen.
that.
But they can still get all the tax documents.
Yes, they still get all their tax documents, they still get their deductions, it is just not recognized publicly for people, and we have quite a few anonymous donors already.
Any other questions for Chelsea? Thank you,
Good job.
Chelsea.
it's very
Appreciate it.
impressive.
What's going
Very
on?
nice.
Okay, so that brings us to item number 10, medical staff report. So if you have medical staff appointments approved at the medical staff meeting held July 9th. With some initials, some reappointments. Do I have a motion to approve the medical staff appointments as listed?
So move.
Thank you. Do I have a second?
One second.
Thank you. All in favor, Rich,
Aye.
Shelley,
Aye.
Ken?
Right,
And I vote aye, thank you. Okay, that moves us to item number 11, which we have tabled. So then we move on to item number 12. I don't know, board members, if you had a chance to review this, it's the same self-assessment that I brought forward before. I thought we might have a discussion on whether we want to move forward with doing the self-assessment, if we want to wait till after November, kind of what board members. When did we do it last year? We haven't done it yet, we just have discussed it.
Oh,
Yeah. Oh, no, because you and Sherry were pretty new, and so we thought,
Yeah.
well, maybe we
That was
should.
me.
I think we did
Yeah,
something like,
we did,
Yeah.
yes, it's the same, it's the same.
when I looked at this, I thought it would be I heard you after.
Better to do after. Okay,
And-
okay. Any other thoughts, board members?
I'm okay.
Agreement, disagreement? Okay, it sounds like there's no strong opinion except for yours, Ken. Okay.
Is it after what?
After November.
Okay.
Yeah, she'll probably be November board meeting, not December board meeting.
Will be due then, by then, or?
No, we'll bring it back
Okay.
forward and see if this is the format that we
Gotcha.
want to use.
Okay.
Okay, so then we have future board meeting agenda topics, anything that we need to add that's not here, that any board members want to add. Or staff want to add. All right, then, do we have closed session items for today?
There's no updates.
Okay, I didn't think so. All right, so then I'm just gonna skip the closed session and the report on closed session, since we aren't having one. Our next board meeting will be on August 29th at 3 p.m. here in the conference room, and meeting's adjourned.
Thank you.
Thank you all.
Thank you.
Thank you.
Thank you.